Hello, Frederico. How are you? We
Hi,
are live
I'm
right
well,
now.
doctor. How are you?
I am fine, thank you. Thank you for accepting to join me in this webinar to give us a little bit of a teaspoon about your fantastic software from Crisalix. Good evening, everyone. Today, my guest is Fred Arico from Crisalix, is going to show us a fantastic software and how can we apply this software in our facial aesthetic practice. Fred Arico, before you go on with your software, I guess when Crisalix first appeared, it was used with breast surgeries and the body surgeries. Then it continued with the face, and recently it's been used for the non-surgical facial aesthetic practices. Am I right?
Yes, you're absolutely right. When we started, it was only breast actually, and it was done by using just three normal photos and using a very slow technology that would take sometimes 30 minutes to create the 3D. And then some simple simulations could be done on that 3D. This was
Mhm.
10 years ago. And then we introduced the 3D sensor that allowed us to create accurate images of breast and then face photos as well, and then body. So below the breast, above the knees for liposuction or for tummy tucks, etc.
Mhm.
More recently, we introduced a new technology that takes advantage of artificial intelligence and deep learning, and we now can do a 3D in about 30 seconds by using three normal photos, one frontal and two 45-degree photos, and we can do that to create a 3D image of a breast or of a face. And because the resolution of the photos is better each time, each day they evolve very well, the cameras are better, and also our technology is evolving very, very fast. Now we can see images with very good resolution that can be used very easily for non-invasive treatments on the face.
Mhm. This is amazing. What makes Crisalix special than any other softwares?
To be honest, there aren't many 3D softwares in the market. There are other systems, but I would say that our main advantage is that we're not just a 3D simulation system, we are a business pack. So there is the 3D simulation part, there's the communication with patients part, there's the marketing part, etc., etc. And the other big advantage is that being cloud-based, anyone from anywhere can create their own 3D just using a mobile phone like this. So you could just take three photos of yourself, upload them, and within seconds you could look at your 3D right here on the screen.
Yes.
So
And
the,
it's
the
amazing
examples we
how
will use
much we can
today.
cope. Yeah, and how it's very good. How can how can we cope with the virtual era that we are living in? Nowadays, we can do everything virtually. The patient may send us their photos from their own home. They may have an idea about how they are gonna look after the aesthetic practice. Because you know that always patients tend to have this fear: how am I gonna look after what I'm gonna do? And by using this visual simulation thing, you can show them the enhancement procedure, how it's gonna like lead them to. So I'm not going to exhaust you with our discussion. I want you to show us your software. So if you could just flip your camera and start.
Okay, I think I will start with a very radical case of a lady who is quite aged, and her skin is quite aged, and she has lots of wrinkles. The quality of the 3D is quite good, and it was created just using that system, posting three photos on a link on a website and then creating the 3D. The main advantage of this, I should note, is that anyone, any patient from anywhere can create the 3D, and then a surgeon or a doctor, just like yourself, on the other side of the world can do a remote consultation based on that video. And
Mhm.
everything is within Crisalix right now. We also have a video communication system within our application. So you don't have to leave and use Zoom or use Skype. You can just remain in Crisalix because it's GDPR compliant and HIPAA compliant. So you will remain in a safe environment, both you and your patient. Okay, so let me try to flip my camera here on my phone. And please tell me if you can see my screen. Can you see
Yes,
my
I can
screen?
see it. Yeah, I can see it very well.
Okay, good. So this is
Could
my
could I
laptop.
ask you for just to move the screen a little bit forward, because it's like brighter at the down and it's starting to be a little bit darker up.
It's darker on the top, you say?
Yeah.
So maybe if I adjust it,
Yes, this
is
is
this
perfect.
better?
Yes,
Okay,
yes.
good, good. So this is a 3D of a patient, and this 3D was created using that 3-photo system with artificial intelligence and deep learning. And this 3D can now be analyzed so that we decide what is suitable for this lady. Let me zoom in a bit so that we see the lady better, okay? And I will start, if you allow me, by using these analysis tools that will give you some information about your patient's angles. And I believe anyone dealing with aesthetic procedures on the face would find useful to have these angles in order
Exactly,
to
because we always talk
analyze.
about the normal facial and the normal ratios and normal facial proportions. So it's amazing how can with
Yeah,
software you can fully measure
exactly.
those angles and planes. Yeah.
Yeah. So besides the angles, we also have some specific measurements for the nose and mouth areas. But what you were referring are right now the proportions, which are very helpful. Here we go. We have the proportions here, the thirds.
And the fifth,
And we also have, sorry, come again?
the rule of fifth. You have the fifth
The rule of fifth,
proportions
yes.
also.
Yeah.
Yeah, perfect.
This is your rule of fifth here.
Yeah.
Okay.
hmm
But we have something even better, because this is just analysis, this is just evaluation. But what if we want to see visually how asymmetric or symmetric this patient is? So we can just use this amazing tool. And if I go on this button here, I will flip the right side of the face onto the left side. So we will see the patient mirrored as if she was totally symmetric. And this is
hmm
how it goes. So this is our patient. If she was totally symmetric from right to left, and that's reality, symmetric. And if I tap the other one, this would be her if she was symmetric from left to right. So again, reality and symmetrical. Okay?
I can see.
So I will remove this. And I will start by showing you some basic tools that we have that allow you in a very easy way to do some simulations to the patient. And I will start by doing some shape changes on the patient. So for instance, if I want to narrow or widen the nose, if you see, I touched that line and it became red. Now if I tap this button here, symmetric, then I can play with her nose. I will exaggerate so that you can see what I'm doing. Can you see as I change the nose?
Yeah, but as I told you, the screen is a little bit far. If you can zoom in, it will be much more better.
Okay, let me try to zoom in a bit more.
Okay,
Is this
this
better
is
now?
better. Yeah, this
Okay,
is more better.
okay. So I was
So
just
you are
playing with
right
her
now, you
nose
are
like this.
manipulating the bridge of her nose.
Exactly, exactly. Yeah. So I just did some changes there. I will delete them. Okay, that's her back to normal. So I will narrow a bit the bridge. Okay. And I will go to the alley here and I will narrow them a bit as well. I will then, I think I will raise and try to give us some volume here on the cheekbones by raising the skin like this. Okay. I will also try to do something to her lips and make them look a bit more plumped with a bit more volume. Okay.
You are lifting the tip of the
Here.
cupid bows for her. Mm.
Can you repeat, please? Sorry.
You are lifting the tip of the cupid bows for her.
Yeah, yeah. So I will now change my angle and I will go sideways like this. Okay. And I will go here on the dorsum and maybe lower the nose a bit like this. And I could play with the tip a bit like this. I don't know if you can see the tip changing.
Yeah, you are like pressing her in, and instead of it's being a very pointed.
Yeah,
Like this, and so, yeah.
yeah.
Frederico, I want to
Now
ask
I'm
about
adding a bit of,
something. When you add
yes,
some volume
please
for
tell
the
me.
cheeks, when you add some volumes for the cheek, how can you estimate how much filling material do you need? I mean, how can you transfer the data from the software to your clinical practice to estimate how much
Well,
volume do I need to give this result?
we can have an estimation of the volume change on the patient, but you know that one, let's say, 1/10 of a cc would mean something on you, would give you an effect on you, but would give a different
Mm-hmm.
effect on a different patient. So we can't really estimate how much product would have to be used
Mm-hmm.
to achieve that effect. That has to be from the doctor's experience.
Mm-hmm. I see.
I will go on and add some volume here as well. And I will try to stretch here a bit, maybe a bit more. And then I will do something else to complete the effect. I will raise the jawline here a bit as well, and I will take a bit of ptosis away from the neck.
Mm-hmm.
Okay, and maybe why not enhance the chin a bit? I think she could take advantage of that. Okay, let's take a look at her from below and maybe work a bit on the volume here as well. I don't want to exaggerate. So let's take a look at her from the front. Okay, so we've stretched a bit. So to give the final effect of the treatment, obviously we would have to simulate something on the skin. Do you agree?
Mm-hmm. Yeah, exactly.
So a very easy way to do that is
And I guess
just
about
to draw the
there
area.
are some areas of hyperpigmentation. Can you lighten those areas?
We can work on that as well, yes.
Mm-hmm.
Let me just try to take these wrinkles away and the nasolabial fold here to make it look a bit younger.
Because usually when you left the cheek,
Okay.
the nasolabial fold is going to be eliminated a little bit.
Exactly, exactly. And that's the effect that I wanted to resemble with the simulation.
Mm-hmm.
And I'm drawing with my hand on my trackpad. I'm not a very good artist.
Mm-hmm.
Okay, a bit of the wrinkle away. I would go there and try to work on that wrinkle over there as well. Okay. Just a few days ago, we had a problem with our laser tool. Let me see if it's working now. So the laser tool just resembles, I mean, the effect of a laser.
Mm-hmm.
And I think I might have exaggerated over there. So a
Mm-hmm.
bit less intense treatment. And working on the pigmentation, as you said.
Mm-hmm.
As you see, I'm firing the laser away on just the right side, oh, sorry, the left side of her skin. And I don't know if you can see on your side the pigmentation being removed or being
Yes, you
at
removed it
least
from the left
improved.
side of the patient. Yeah.
Yeah, exactly. I don't want to overdo it. I just want to make it look a bit better, and also at the same time take some wrinkles away from the tear trough here.
Mm-hmm.
And I don't mind if she looks different from one side to the other, because then we can compare the differences. I
Mm-hmm.
think I would also
I guess this is
remove.
better because patient can see how her face can change when you leave her, like, when you leave the original duplicate on the other side.
Yeah, I will do that. Just want to do this. So actually, instead of seeing it on the other side, let me show you like this. So that's before the treatments,
Mm-hmm.
and that's after the treatments.
Yeah, you gave her a nice OG curve by lifting the cheeks and the pre-jowl area. Yeah, I can see.
Yeah. So
Uh, uh, Frederico, does this software can be also used with dynamic pictures or dynamic videos, or we just have to you can manipulate the face at only at rest position?
sorry, I didn't get that because there was a little, there was some cuts on the line. Can you repeat your
Okay,
question, please?
okay. I was just asking you, can this software be used for dynamic videos or dynamic pictures, like the patient, if the patient is smiling or frowning or laughing, or we just have to manipulate the picture during rest position only?
So it's better to keep one standard position, but you can create a 3D in any position that you want. So if you want to create a 3D while the patient is frowning or while the patient is smiling, you can do that.
Mm. Can we use it on
If
videos
you
also, or
want,
just on pictures?
not on videos, no, not on videos,
Mm-hmm. Mm-hmm.
just on static images.
Okay, I see.
That you can
But you are right, because once you did
see
the
the
3D
before and
pictures, you
after.
can like merge the pictures along with each other, and you can give it like a dynamic picture, as if she's like smiling and returning back to rest, and so on.
Yeah, exactly, exactly. Let me show you something. We can see the before and after side by side like this.
Yeah, this is better, and she looks
You were
natural, by
asking
the way.
something, and there's something that I wanted to tell you.
I'm
Yes,
sorry.
go ahead.
No, no, I wasn't asking. I was just listening.
Oh, okay. Let's say that you want to have a track record, a history of a patient. So the best way to have that history is to do a pre-op or a pre-treatment 3D. And then for every treatment that you do, you can do a second 3D. And then you can compare one with the other to see the evolution between two treatments. And when I say see
Perfect.
the evolution between two treatments, you can see the evolution between 2, 3, 4, 5, 10, 100 treatments if you want, because
Mm-hmm.
you can have all the images, you can collect all the images that you want. So you have your patient's history in one place, which is your Crisalix
Mm-hmm.
license. One big
Mm-hmm.
advantage of this is for those cases that your patient comes after a few weeks and she says, "Oh, doctor, there is no difference. I'm
Mm-hmm.
looking just like I did a few weeks ago." And you can just create another 3D and compare it with the previous 3D and show her, look, here is a difference. You have some difference here. Your nasolabial
Mm-hmm.
fold is different, or your lips look different, or your jawline is different, or your tear trough, whatever, you know? So it's very good
Mm-hmm.
for record keeping so that
Mm-hmm.
you have your patient's history.
I see. That's perfect. By the way, I want to ask about something. Sometimes when you do some measures on the software, and when you try to take those measures to apply it on the real patient face, there is a magnification factor or some calculation that you should be doing. Is the same occur with your software, or it's very realistic that it measures like the real measurement on the patient face?
It is very realistic, and the margin of error is similar to the margin of error for human measurements, for when you measure by hand using a ruler or a caliper or something.
And so it's very accurate and precise. Yeah.
Yeah, it is. It is. And it will give you the difference. So, for instance, if you straighten the nose or change the jawline or something, it will give you the difference between one thing and the other.
I see.
So you will know exactly how much you've changed.
I think you are doing it beautifully.
Is this something that is common in Egypt?
To have this magnification factor thing?
No, I mean to have 3D imaging software.
Yeah, it's not very common, but of course we do a lot of comb BMCT, we do a lot of 3D pictures, but we don't like apply software, virtual aesthetic or softwares into our practice very much. That's why I was very interested in the topic, because it's not something like you see it on a regular basis.
Yeah, we believe that Crisalix can be a differentiator. So, I mean, if I am a patient and I have that doubt that you mentioned in the beginning, how may I look after my treatment? I will certainly want to see something, to know something. So,
Exactly.
if someone
That's
can
why I
offer
was
this
very,
and someone else
yes.
cannot,
Yeah,
I will
I
choose
was
that
very,
person.
yes, I was very excited about the webinar because this was how I was thinking about it. Because I have 80% of my patients are always asking me how I'm gonna look, despite how much pictures they show them for previous cases or for other people who did this aesthetic procedure. They still have this fear how I'm gonna look. So if I can offer them something, then you give them even if a little bit of a virtual imagination of how they are gonna look after my intervention, I guess this is gonna be like fabulous thing.
Exactly. Do you have live questions from your viewers
Yeah,
on the webinar?
I wanna. No, you just finished your demo, right?
I have. If you're happy with it, unless you want me to show
Yeah,
something else.
it's amazing. Yeah, if sure, if you want to go on with anything else, go on.
No, not really. No, I think I'm done here. I
Okay.
think I've shown
Can
you
you flip your
what I
camera
wanted to
so I
show you.
can see you better?
Sure. I will flip my camera now. From camera. There we go.
Oh, you are back again, but the picture is a little bit dark. Actually, it's so dark.
Okay.
Yes, but the picture is dark, Fred. Now I can
It's a
see you
bit.
very well. Now it's better. So tell me how, if any of
Okay.
my
Good.
audience wanna purchase
Good.
this software, how can they contact you, or how can they make contact with Crisalix to apply this software in their own practice?
So our website is crisalix.com. And I think if they follow your social media accounts, they will see the name of our company there, Crisalix. If they want to contact me directly, they can also contact me directly here on Facebook, or they contact me on Instagram. It's my name, Frederico Roldao, Crisalix. It's very easy. It's just going on Crisalix or one of the accounts, and they will find us very easily.
Okay. May I
On
post
our
the link
website,
of
there's
the
lots of
page?
information,
Yeah,
and
may I
because of
post the link
the
of the website
restrictions
and
posed by the
your
COVID.
account page? Yeah, may I post
Sorry, come
the
again?
link for may I post the link for the website and for your Facebook and Instagram page on the webinar so people may contact you if they are interested in the software?
Yes, of course.
Okay, this is great. Thank you
Yes,
so
of
much,
course,
Fred.
of course, of
Th
course.
Thank you so much, Frederico, for your time and for sharing with us this fabulous software. I guess I'm going to be the first one to try it in Egypt. Thank you so much for your time, and have a good night.
You too. Thank you very
Okay,
much.
you are welcome. Bye bye, Frederico. Bye bye.
Bye.